and pick up tomorrow. Highway 51 Exchange.
DeWittDailyNews.com is the area's leading local news source 24 hours a day, 7 days a week. Get the latest local news, obituaries, police blotter, weather forecast, and more with no paywall. Head to DeWittDailyNews.com to get the local information you need to know.
Your friend in Central Illinois. WHOW.
Top of the morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. My guest in studio this morning, State Representative Dr. Bill Hauter. And Dr. Hauter, good to have you in studio. How you doing this morning?
I'm here.
Yeah. So you didn't come
the
just
big,
to you didn't
beautiful barn.
Yeah, the big beautiful barn. We call it the Big Red Barn down here,
really.
but surely you didn't come to Clinton just for this today,
No,
did you?
We got things. I got a couple meetings, and especially we're going to have lunch at the new Shore House restaurant with a couple elected officials and key leaders. So I'm going to be excited about that. So yeah, and my staff's coming, and I think I'm going to take a boat out on Clinton Lake.
There you go.
I've always wanted to be out on the lake, and so I rented a pontoon boat. It was easy to do online. And,
really?
Yeah.
Nice.
We're going to go out. I think I'm going to take my staff out, and we're going to
have a day on the lake,
cruise around Clinton Lake.
That's amazing.
Yeah.
That's amazing.
Yeah.
Good stuff. By the way, you can pull that mic closer to you if you don't want to lean into it. That's totally fine.
Sure.
Let's start the day, Dr. Hauter, talking about a bill. And I think this was a proposal. It didn't go through in the spring cycle. You think it's going to come back around, essentially taxing the entire state to fund public transportation in Chicago. Give us the skinny and we'll go from there.
Well, surprise, surprise, there's another crisis in Chicago. So
a financial one at this. Yeah.
So they have three major entities that handle mass transit in Chicago. And there is a huge funding crisis. Again, after COVID, their ridership went way down. They haven't reformed the routes or the bureaucracy associated with having three agencies that handle mass transit: PACE, RTA, something else, I forget it now, Metro. And so instead of reforming the bureaucracy and reducing routes, they just want more money, and they want more of other people's money. And so you may have heard of the delivery tax that they were thinking about, adding on every package and every delivery in Illinois was going to be $1.50, which is crazy to me as well. I mean, why would you not do it on a percentage basis of the total cost? I mean, if you're gonna pay $1.50 for a sandwich delivery from Grubhub, $10 sandwich delivery, and you're going to pay
$1.50. That's 10%.
Yeah,
more than 10%. Yeah,
or you're going to pay $1.50 for a $3,000 TV delivered from Amazon. It's $1.50 for
the scale to proportion.
Delivery. It didn't make sense. So it was poorly thought through. Again, just business as usual. There was a huge outcry among the whole state. They thought they kind of thought about a service tax. Yeah, you may have heard of that. I got so much email and calls about opposition to it all over the state. There was strong opposition to it. In the end, it died in the House. They passed it in the Senate. $700 million of funding, new funding. So it really is just a way to fund it and to sweep under the rug the reforms needed, Seth.
Yeah. So and I got to thinking about this, for like our family, Grubhub, DoorDash, it's a relatively new concept in Clinton. More and more people are taking advantage of it. But places like, Jimmy John's Deliver, Monocle's, Casey's, these small town Illinois establishments, they have delivery. And I think to myself, like somebody that's thinking about it like like a doctor who works at the hospital, they want that Jimmy John sandwich, just a quick sandwich for lunch. I got to get back to the floor and do my shift.
I want it freaky fast.
And want it freaky fast and all that stuff. And they say, but you know what? I'm going to order an $8 sandwich. I've got my chips and my drink here. I'm not going to pay $1.50 on a $8 sandwich. I'll
plus
just
tip plus tax.
Exactly.
Yeah,
And
and
so
now they're charging a service fee.
exactly. And so it's like I'll just bring my own lunch,
Yeah.
you know. And you're gonna. I feel like you're really gonna cut out people's like willingness to take advantage of those things.
Yeah, if we're not taxed enough in Illinois, I mean, it's just crazy. In the last budget bill, we increased taxes again. You know, great chance to cut spending. I mean, this is an unbelievable idea. Cut spending, reform spending. They just cannot conceive of it ever. I thought it was bad, you know, just as a regular citizen before I got into all this. I thought it's terrible, the tax and spending that's going on. And now being in it and seeing how the meatloaf is made, it is just it's very, very to me it's astonishing.
What is the most astonishing thing you've seen, heard, experienced? Well, give me two or three.
Well, the budget has to be balanced by constitutional. You know, it's constitutionally required in Illinois to balance the budget. We can't print money like the federal government can, and so we have to balance our budget. Well, we don't really do that, and we sell it as a balanced budget, but it's a gimmicky balanced budget, and the only way we can continue to carry debt in Illinois is by not funding our pension liabilities. And so we have the highest pension liabilities in the nation, $140 billion of pension liabilities that's unfunded. And so what we do is we just instead of printing money, because we can't, the federal government just prints more money, and we see with the deficit spending that's going on, it's just trillions. It's almost inconceivable. It's almost, you can't really even fathom the amount of debt this nation is in. Illinois can't do that constitutionally, so we do it by basically pulling the wool over Illinoisans' eyes and faking like we're balancing the budget. We aren't. We continue to spend out of control, and the spending on new programs and not reforming anything. You know, my business, Seth, is medicine, and I come from a career of everything's measured. You can only do things if there's evidence. If there's no evidence for it, if it doesn't work, you can't do it. You can't do it on patients. You can't experiment on them.
And yet we're experimenting on Illinoisans.
Basically, I mean, we are doing things that it's really hard to battle untruth and their reality and their truth, because it's like we know that you know the budget isn't balanced. It's balanced by shifting funds around. It's balanced by saying we're only going to spend $110 million on illegal immigrant health care this year, when we've never been able to even get close to that budget amount. But you just say that that's what we're going to spend. Later in the year, you just do a supplementary spending bill, and you end up spending $1.2 billion on illegal immigrant health care. But you just say that you just budget for $110 million. It's like the same thing. You know, you're going to spend, let's say, $1,000 a month on food. But you just say at the beginning of the year, you say, I'm only going to spend $500 a month on food. But later in the year, you'll just another supplementary spending bill. But it looks like we're only going to spend $500 a month.
Right.
Well, we've never spent $500 a month. We've always spent $1,000. So, you know, it's
it's one of those things. I feel like there's a couple things here where, you know, all this political jargon that these politicians put out, you know, supplemental spending, supplemental bills, you know, we didn't learn that in economics or in government when we were in high school. Supplemental bills. What is that? I mean, it just feels like it's a bunch of games. And, you know, I think people just lose interest when jargon and lingo like that is put out there, and it's like, okay, whatever, you know, Illinois is doing this, you know, I don't understand it. And so like they kind of lose interest at that point. I think the other thing at play is you've got in Chicago, all these politicians sharing, you know, basically that all the things you're telling, or, you know, the party lines basically to their constituents, whereas messages from Republicans can't penetrate because there's no Republicans up there. You know what I mean?
Well, it's not popular to cut spending. and we see that all over the nation. I mean, even in the big beautiful bill, which we'll talk about later, there's very little spending cuts, and it's all these politicians realize that the way they get reelected is if they basically keep programs that were there. No reform. If you dare reform Medicaid, Medicare, Social Security, you're going to be demagogued. You're going to be criticized, and you're going to lose your spot. And these people,
and that's what it's all about. It's all about keeping that spot in Springfield or
and
Washington or wherever it is.
Exactly. And that's why I think it's so important. I'm a physician. I'm a citizen legislator, and it gives you a great perspective. And also, my identity isn't in Springfield. Isn't being a politician, and my livelihood and my kingdom. And so, I mean, fine. I love what I'm doing. I love representing the 87th district. It's been unbelievably satisfying, and I have so much gratitude that I'm doing this. But I feel like I can speak the truth and make decisions based on what I think is important, and not to get reelected. Because if I don't get reelected, you still
go to the office tomorrow.
That's not my identity. That's not my livelihood. That's not is in my community. It's being a husband. It's being a father. It's being a physician. And so many of the people I see in Springfield, I'm sorry, but this is the pinnacle of their life, and they can't imagine not being reelected. And it's the most they've ever made. There's way too, again, in this bill, another pay increase. Every budget I've seen in my 3 years of voting on budget has had a legislative pay increase. So I've voted no on every budget because there's so much in these budgets, so much spending, tax increases, and raises for legislators, and on and on.
Very good. Well, Dr. Hauter, we flew through about 12 minutes there. We did. I'll tell you what, let's break here. Come back with some more. State Representative Dr. Bill Hauter in studio with us. More to come with him on the morning show.
WHOW.
Let's check the opening numbers now at the Chicago Board of Trade on this Thursday. Jim Taylor on the RFD Radio Network. Kind of a steady start here for corn, beans, and Chicago wheat. September corn opening 404.5 down 3/4. December corn 423 1/4 down 3/4. March corn down a penny 440. August beans starting today 10.14 up half a penny. September beans up 1/4 10.06. November beans 10.20 1/4 down 1/4. September wheat opening 536 3/4 down 4.5. December wheat down 4.5 557 1/4. March wheat 575 1/4 down 4.5. August bean meal 267.30 down $1.10. August bean oil 55.16 up 34 cents. Opening numbers on this Thursday morning. Jim Taylor on the RFD Radio Network.
Is the summer heat getting to you? This is Scott Baum from Baum Chevrolet Buick in Clinton and Farmer City, inviting you to cool down in a new Chevy. We have cool new crossovers like the Chevy Equinox, or hot new trucks like the Chevy Silverado 1500, which has up to $7,500 in extra savings over our regular discounts. See all our inventory and prices online. And don't forget, we need and would love to trade yours in. Chevrolet, together let's drive. BaumChevyBuick.com, right from the start.
SIU Family Medicine wants the best health for you and your family. Be a champion. Protect your loved ones. The SIU Center for Family Medicine of Lincoln is accepting new patients. Click their icon at DeWittDailyNews.com to schedule your appointment.
Hi, I'm Brett with Central Cremation Center. We're proudly offering pet cremation services to help keep your faithful companion close to you. Learn more about our pet services by clicking our icon at DeWittDailyNews.com.
Your friend in Central Illinois, WHOW.
Once again, good morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. My guest in studio this morning, State Representative Dr. Bill Hauter. And Dr. Hauter, you referenced the big, beautiful bill out of Washington that passed just before the 4th of July. I want to get your perspective on this because we've heard so much about, healthcare cuts and Medicaid cuts and obviously that's going to impact or Medicare cuts. That's going to impact Medicaid and rural healthcare. I mean, even our rural hospital has been watching this very closely. So give me your perspective on what exactly is in the big, beautiful bill from a healthcare perspective. How does it impact Illinois?
Well, it's really complicated. And
of course.
Medicare and Medicaid is really complicated. Medicare is the federal system for elderly people. Medicaid is a partnership between the federal government and the state to take care of the poor, really the vulnerable populations. First of all, I'm all for cutting waste, fraud, and abuse, and I think with this bill, some of that will be cut in Medicaid. Mm-hmm. And also, there's been a huge expansion of Medicaid. Medicaid population expanded exponentially, especially since Obama era. The ACA increased it. The federal government said they would pay 90% of the cost of the expansion. And that's been true. Not every state participated in the expansion, but the expansion happened in Illinois, of course. And Illinois' participation was 10%. So there's really no skin off Illinois' back to expand that population because they're only paying 10% of the costs. Mm-hmm. Well, the federal government is in partnership with the state, and they're paying for most of the costs. There's a formula for the rest of, not the expansion part, but for the rest of Medicaid. There's a formula, and Illinois pays so much, and the federal government pays so much. So, suffice to say, there's some sort of partnership. The terms from the federal government are changing, and some of them are going into effect in 2027, and that will be work requirements because it was for the working poor, and
the most vulnerable,
most vulnerable, and it was for those who were disabled, and so I think those reforms will make it more available to those who really need it, and those who can work and don't need it won't get it, and so it'll help somewhat save Medicaid. The other issue with Medicaid is the federal government and this administration will only pay for citizens of the United States. Okay, Illinois has taken a strong stand, and I've been very opposed to this, of using healthcare dollars to pay for non-citizens. Let's just say non-citizens. Okay, many here illegally, and they've been using our dollars to the tune of billions of dollars, and that will stop, or Illinois will quit getting money stop getting money from the federal government. So there's reforms coming, and we're going to see if Illinois is going to reform itself and also only spend their healthcare dollars on citizens, if they're going to fight the federal government. And I'm very concerned that this administration, everything I've seen, I'm talking about the Pritzker administration and the supermajority party, is tuning up for a fight, and we may lose billions, millions, maybe even billions of federal funding for Medicaid, all in defense of non-citizens of this state, of this country. So.
What about, and this is kind of maybe more broad than Illinois, maybe more southern Illinois, but then there's other parts of the Midwest this would impact. The talking point that millions are going to lose access to health care. There's going to be a shortage of availability and things of that nature. How about some of that?
I mean, the reforms will cut down. I mean, when we're talking about only you have to work there's like 20 hours a week you have to work. There's you have to be a citizens. I mean, the reforms are going to cut back. The other thing is there's a Medicaid, there's sort of a special assessment to hospitals that will be the return they get from that tax is going to be reduced. So that will affect our hospitals, knowing that they have a $50 billion fund to help rural and hospitals that are safety net hospitals. And so we'll see how that pans out, but there is some funding to make sure that these hospitals don't close.
I wanted you to speak to your firsthand experience and just generally, Medicaid was never meant to be as big as it is, and so I guess what have you seen, whether it's, and I don't know if it's impacted your practice or you've seen in just healthcare industry writ large, the continued expansion impacting the quality of care people are getting and maybe even the access to care. How has that impacted all that?
Well, for providers, hospitals, you lose money on every Medicaid patient. And so that's a terrible business model. And so many providers don't take Medicaid at all. When you have patients that basically you're going to lose money, you don't have to take care of that patient, the staff, the overhead, and everything. You're going to have to basically pay the state to take care of that patient because you're not making enough to cover your costs. It's really hurt, and some of that is because there's been, like you mentioned, Seth, a continued expansion of Medicaid who's eligible for it, especially during
election years.
Yep. Yeah, right. Especially during the Obama era ACA expansion, where the federal government said they would pay 90% of expansion costs. That continues today. And then COVID also expanded who was eligible. And we've only had a redetermination in the last few years, and it did not decrease it by what we thought it would decrease those who were eligible. So we've had a continued expansion. So now when we're going to cut back on this, everybody's crying that this is terrible and people are going to die and hospitals are going to close. When there's got to be, it's not sustainable. It's not sustainable to continue to expand this program, especially one as underfunded as it is.
From your perspective, what is this feels like it's just all a progression towards socialized medicine. What is your biggest issue with the idea of socialized medicine?
Well, you get what you pay for. And when you have a big bureaucracy and you start rationing healthcare.
How so?
Well, basically the biggest payer, if there's one payer, decides who gets what. And there has to be a centralized decision for all the states, the whole nation, on who gets care, what they're going to pay for, what medicines they're going to pay for. And we see everywhere that socialized medicine has been tried. We see there's a trade-off, Seth. There's a trade-off on wait times, on availability of care, more extensive or expensive care, the latest treatments. All of that is rationed or made available to only those who can afford it, and everybody else gets
shuffled to the back.
Gets mediocre care.
Well, Dr. Hauter, I wish we could go further, but I got to let you go for the day.
Well, thank you for having me.
And thanks for coming down. Good to see you. Dr. Bill Hauter, state representative, our guest in studio this morning. The morning show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. Network news on the way.
WHOW.